Let me help you, dear.
Oh, thank you.
What are you in here for?
My heart pump isn't working very well.
Mr. White, you can head on back with me to the examination room now.
All right.
How are you doing today?
I've been better.
Okay.
Gee,
Oh, no.
hallways are too narrow.
So, Mr. White, it sounds like you're in here for a fever?
Yeah, you can call me Tony. My friends call me Tony Curls, but
Okay.
you can call me Tony.
Okay. Tony, have you noticed any other symptoms besides your fever at all?
Well, you know, I usually really like to eat my old lady's cooking, and I haven't had any of it lately. I just haven't been able to. I've had a lot of cramps and a lot of stomach pain.
Okay.
I've been throwing up a little bit, too.
So nausea and vomiting?
Yeah,
Okay. Okay. Have you noticed any changes in your urine at all?
I noticed it is darker lately.
Okay.
A lot darker.
Okay, what about your stool? Is it brown, soft, or has that changed?
Well, you know, I really don't like to look at my stool, but the couple times I have peeked, it's been a little bit gray in color.
Gray, okay.
Yep.
Okay. And have you noticed any yellowing of your skin or your eyes?
Well, you know, I don't really look in the mirror too much, but my old lady, she said that my eyes have been a little yellow lately.
Okay, yeah.
Have a look.
I noticed that. Okay. And lastly, have you noticed any joint pain at all?
Yeah, I've been real sore all over.
Okay. So, Tony, it looks like you have quite a few symptoms. I'm going to go talk with your physician and see what he would like to do. We might do a blood test and find out what's going on, okay?
Well, you guys know what's best.
Yeah, it'll take a few days and we'll have you in here as soon as we find out.
Okay.
Thanks, Mr. Wright. Hi, Tony.
Hey.
Sounds like your symptoms have gotten worse since last time.
Well, yeah, they got me back in this bed again. Feels like I'm back in prison.
I could see that. So for starters, I'm just going to take your temperature to see how that fever's doing, okay?
All right.
Stick that under your tongue for me and back down.
Just wash the mustache.
Okay. Looks like you're running a fever of 101, Mr.
What's
White.
normal?
Around 98.6.
So that's pretty high then, huh?
And all the other symptoms are still there, like your abdominal pain and everything?
It's all gotten worse, yep.
Okay. Okay, and you know, your blood test came back, and it looks like you're positive for hepatitis C.
Dang it. I knew it.
So why don't we get a little bit of a medical history from you to see maybe where you contracted the disease, okay?
All right. There's going to be a lot, though.
Okay, so first, can you tell me about where you're from and a little bit about yourself?
I'm from Cascade County, and, you know, when I was a young lad, I didn't have the easiest of lives. I kind of ran with a bad crowd and ended up getting into some drugs.
Okay.
Got pretty heavy into drugs. I did a few crimes, and, well, I ended up in prison.
Okay. So you said that you were doing drugs. Were those drugs like intravenous drugs?
You mean like, did I shoot drugs up?
Yes, sir.
Yep, a lot.
Okay, so you know, sharing needles puts you at a higher risk for contracting hepatitis C.
I wish I'd have known that then,
Yeah.
but
Have you ever had a blood transfusion, Mr. White?
yeah, I did once. I got stabbed.
Oh, okay. Do you remember what year that was?
Well, it had to be back in '89 before I went to prison.
Okay,
Like I said, I had a wild life.
yeah, so you know, before 1991, blood wasn't scanned for hepatitis C, so that puts you at also another higher risk.
Well, I guess that's that then.
Yeah. Same with organ transplants as well before 1991. Have you ever had an organ
I
transplant?
didn't have an organ transplant.
That's good.
Not that I know of. There was that time in Mexico, though.
But we don't talk about that,
We
right?
don't talk about that time in Mexico.
Okay. So how about your sexual contact? What does that look like at all?
Well, right now I've been with my old lady since I got out of prison, but
Okay.
before I was in the joint, I was kind of a wild lad, and you know, with the drugs and whatnot, I made some pretty poor decisions and with a lot of loose women.
Okay. So, Mr. White, that actually increases your risk as well because you never know if your sexual partners had hepatitis C or not. So that puts you at another higher risk.
Well, wish I'd have known that then.
So, Mr. White, do you know very much about your mother at all, or if she could have had hepatitis C?
I was adopted. I don't know anything about my mom.
Okay, so that puts you at a 5 to 6% higher chance. So if there's any way for you finding out, that is also another way you could have tracked hepatitis C. Have you ever had a history of an STI or HIV?
Well, you know, I had the clap, and then I had the crabs once, and then I had HPV once.
Oh, wow.
Still have it.
Oh, wow. So those are all risk factors as well, okay?
Yep. Had a hard life.
Did you ever have a tattoo maybe that could have possibly been given with an unsterilized needle?
Well, I tried to stay away from tattoos, but I did get one while I was in prison.
Oh, okay. And that needle probably wasn't sterilized, was it?
It was used on about 10 other fellas.
Oh, okay. Okay. So that's another way you could have gotten hepatitis C. And then have you ever had medical treatment abroad?
Well, like I said, there was that time in Mexico, but I don't remember much about it.
Okay. So that puts you at higher risk because oftentimes in other countries they don't sterilize their equipment and it could have blood on it from somebody who had hepatitis C.
I imagine it would.
Okay. So now that we've gone over some of the things and some of the ways you could have contracted hepatitis C, Mr. Wright, let's talk about your treatment right now, okay?
Okay.
So early treatment is very important because oftentimes your acute hepatitis can go into chronic hepatitis. And with chronic hepatitis, you can get cirrhosis, fibrosis, and liver failure eventually.
Not good things.
No, so we need to act quickly, okay?
Yep.
Okay, so unfortunately there is no vaccine, so that's not one of our options that we have. So right now your physician would have originally prescribed to you a direct antiviral agent, which would have stimulated your body's immune response. But right now there's a new drug called Harvoni.
Okay, I'd like to know more about that.
Okay, so this drug will actually decrease the amount of virus in your body. It targets all the different types of hepatitis C because they're all several different types.
Alright.
And it is actually a combination of 2 drugs.
Alright.
And because of that, it makes it a little expensive.
How much are we talking? I bought a lot of drugs in my life.
Thousands of dollars, Mr. White.
I can't afford that.
So you know, an option would be to talk to a financial counselor and see what your options are.
Alright, I'd listen to what they have to say.
Okay, so Harvoni is this drug right here, and you take it once a day. Do you think you could follow that regime?
Well, I'd just have Gladys give me my pills.
Awesome. Okay, so Mr. White, we kind of went over some stuff for you. Treatment, I would just advise you and your wife to talk over what's available to you guys.
Alright.
And keep us updated on your symptoms, because those will get progressively worse, okay?
Alright.
Awesome. Well, I hope you have a better time here in the hospital, Mr. White.
I wish too.
Thanks.
Alright. Thank you, nurse.